A simple cut heals, but for millions, a wound can become a life-altering battle that won't end. This isn't rare. Chronic wounds affect a staggering 8.2 million Medicare beneficiaries in the U.S. The economic burden is immense, costing the healthcare system more than $28 billion every single year. Beyond numbers, these wounds inflict daily pain, isolation, and steal personal freedom and mobility. So why do these wounds persist? And what can a new field of medicine do about it? Let's find out. First, what makes a wound chronic? It's one that fails to heal in an orderly and timely process. Normally, your body follows a precise 4-stage process, stopping the bleed, inflammation, new tissue growth, and remodeling. Chronic wounds get stuck. They often stall in the inflammatory phase, which is meant to be temporary, preventing progress. This prolonged inflammation creates a destructive microenvironment, breaking down new tissue as fast as the body can build it. So, the body's natural healing process is broken. But what is powerful enough to jam the gears so effectively? Often, the culprit isn't just a random infection. It's a highly organized, microscopic fortress. What is it? The enemy is a biofilm. These are communities of bacteria encased in a protective slime, found in over 90% of chronic wounds. This protective shield makes them incredibly resistant to both antibiotics and the body's own immune system, fueling persistent inflammation. Worse, they adapt fast. A biofilm can become resistant to treatment in just 48 to 96 hours, requiring repeated attacks to break down. On top of this, poor nutrition, lacking protein or key vitamins, can cripple the body's ability to build new tissue. We have a stalled process, fortified bacteria, and potential malnutrition. How does medicine even begin to fight back? First, let's correct a common myth. Wounds don't need to breathe. A moist environment is proven to speed up healing. To fight biofilms, we first identify them. Advanced PCR tests can detect the specific bacteria and fungi hiding inside. Treatments like negative pressure wound therapy act like a vacuum, cleaning the area and promoting new tissue growth. And for patients with mobility issues, mobile wound care services bring these advanced treatments directly to their homes. But even with these powerful tools, some wounds still refuse to close. Sometimes managing the environment isn't enough. What if, instead of just helping the body heal, we could give it new instructions and raw materials to rebuild itself? This is the promise of regenerative medicine. It is not about managing the wound. It is about regenerating the tissue itself. Key therapies include stem cell therapy, platelet-rich plasma, or PRP, and placental matrix applications to jumpstart healing. This might sound like science fiction, but it is happening right now. So how do these treatments break the chronic wound cycle? Let's start with PRP. Your own blood platelets are concentrated and applied to the wound, releasing a flood of growth factors. Remember that stalled inflammatory phase? PRP's growth factors provide the powerful push needed to break that stalemate and enter the growth phase. Stem cells go further. They are master cells that can become the new skin, blood vessel, or tissue cells needed for repair. They actively fight that destructive microenvironment by promoting fibroblast proliferation and tissue remodeling, rebuilding the foundation for healing. The results are promising. Studies show PRP promotes substantial healing, and many believe these treatments should be standard care. So why is this advancement so vital? Because the alternative is severe: infection, amputation, and even sepsis. We've seen how a problem affecting millions is a biological stalemate, guarded by biofilms. Regenerative medicine offers a way to rebuild, not just manage. Chronic non-healing wounds are a massive medical challenge, but regenerative treatments are transforming care, offering new solutions and real hope. If you or someone you know is struggling, do not wait. Ask your provider about advanced diagnostics and regenerative options. It could make all the difference. Share this video to spread awareness about this silent epidemic and the incredible science offering a way forward.